For those of you that don't know me, my name is Nancy Butcher, and I'm from the Hospital for Sick Children, and I'm the co-director of Impact. Impact is a clinical trials training platform funded by CHR that aims to increase capacity for perinatal and pediatric clinical trials in Canada through our fellowship program and educational activities such as this webinar series. We really appreciate you all taking time out of your day today and your busy schedules to learn more about the important topic of patient, youth, and family engagement in clinical trials. We are extremely fortunate today to have four experts. We have patient engagement specialists and patient and parent and youth partners all here with us to share their experiences and their expertise with us. So please join me in warmly welcoming Yan, Jenna, Dawn, and Maureen all here with us today. I think, Maureen, you're going to kick us off, so I will hand it over to you at this time, and over to you, Maureen.
Thank you so much, Nancy. Great to see some familiar faces and also some people who I don't know. So welcome. And some of you are having lunch probably. Others are just starting your morning and others are in mid-afternoon. So such is the joy of being Pan-Canadian. So thank you so much for joining us today. And I will be taking a back seat because we have such wonderful presenters, a youth mentor with Impact and a parent mentor with Impact, and our patient engagement specialist, Dawn Richards. So we're looking forward to spending this hour with you, and then the additional half hour for our fellows. I'll start with a land acknowledgement. So I'm in Montreal right now, which is my actually ville natale, where I was born, and I acknowledge that we're situated within the traditional unceded lands of the Canadian Mohawk peoples, part of the Haudenosaunee Confederacy. There's also a historic presence of the Anishinaabe peoples in what is known as the Greater Montreal area. And Teotihuacan, or Montreal as we know it, has also been and continues to be a gathering place for many First Peoples from all directions. And we honor and thank the traditional custodians of this land and strive to work for the success of future generations.
Maureen, maybe I should just indicate this is just my disclosure for people who are out there. So as Maureen said, I'm a sort of a patient engagement specialist. I always declare I do live with chronic disease, and I do work in this area, helping people and organizations to engage patients and the public in their research projects and initiatives.
Thank you very much, Dawn. Okay. So our learning objectives for today are to define patient youth family engagement as it applies to clinical trials, list 3 reasons on why engaging patient youth and family partners may be valuable to your clinical trials research, and discuss some tools and approaches to engage patient youth and family partners with your clinical trials team. You will hear from two Impact mentors, a youth mentor, Jenna Keddy, and a parent mentor, Yann Defossé, and they will tell you a little bit about themselves at the beginning of the first time that they provide some insights about the steps and how we can be how we can work with the research teams in those steps in the research cycle. And for myself, I'm also a patient partner with Impact, and I live with a rare disease, a diagnosis in childhood, and I'm really happy to be providing some support to the mentorship program for our youth and family partners who bring a wealth of knowledge and lived experience. Thank you. Next slide. Okay, so we'll start with a poll. That seems to be the Canadian way, so.
Sorry, just bringing it up here.
Thank you.
Yep.
They're getting their answers in. That's great. Okay. Right, they're coming in. So it's great to see the you bet, but it's also really important that there are people who are saying maybe, and maybe that's why they're here today to learn more about it, and that means an openness to doing it. So that's great, and everyone has to start somewhere. So we want to make sure that you know our that we're open to everyone who wants to engage, and if you haven't done it yet, hopefully by the end of the hour, you're convinced that it's the right thing to do. But great to see those responses. I think we've got almost everyone who's participated now. There we go. Okay. Handing it over to Dawn.
Okay, thanks a lot, Maureen. For some reason, I can't get the poll off my screen. So if you see me clicking a lot, it's because the poll keeps showing up. Maybe it's gone now. So the first thing that we want to do is get everyone on the same page about when we are talking about patients here. So you might hear us say patient, you might hear us say family partner, caregiver partner, youth partner. Those are all going to mean the same thing for the webinar today. We're going to use CIHR's definitions also, just to keep things really simple. So we're all talking the same language. So CIHR defines patient as a fairly inclusive term. So it might be someone like Maureen and I who live with a health condition, who have experiences in the system, but that also might be people like Yan who are a family member or a caregiver, or maybe it's even a friend. So everyone brings a unique perspective around that experience to start off with. The next thing is when we talk about patient engagement. So again, you can sub out the word patient for youth, for caregiver, family member, patient engagement. The important part here of CIHR's definition is that this is about meaningful engagement and collaboration. And that should be throughout the research continuum of your project or your initiative. So patients might be, or hopefully they're involved in governance, they're involved in generating what the important priorities are, what the research questions are, and maybe they're even doing some parts of the research and helping you disseminate the findings from that research. And we're going to talk through that, and we're going to hear from Yan and Jenna today about some of their experiences engaging in the trial space. So we really want things to be practical for you here today. As Maureen said, it's great that many of you do this already, but we're hoping that we can help you add to your toolkit. And we really want you to see through the experiences that Yan and Jenna have had, what things can look like. And we'll talk a bit more about that as we go. One thing we really want to emphasize here is we don't want you to confuse when we're talking about patient in today's webinar, where we're talking about people being members of your clinical trial team with participants. So participants are volunteers who are participating in your study, and they're not on the team itself. And so we just want to make sure that we're really clear on that distinction, that when Yan and Jenna bring their perspectives, they're talking about being members of the trial team. And same with throughout the talk, we're going to talk about people being members of your team, not the participant side of things. So we just want to be really clear and upfront on, again, on language here. This is Maureen's slide. So we wanted to make sure that we kick things off maybe a little provocatively, but why patient engagement? And so I think the cartoon really nicely demonstrates that, here the researchers are the parents. They think the animal mobile is amazing for their baby, right? And then we look at it from the baby's perspective and look what the baby sees, which is really different, right? And so we just wanted to illustrate here that part of why you should consider bringing in patients as partners is just that their perspective is so different. They're bringing lived experience to the team, and it really can also complement the perspectives that other members of your team have. So this is, I think, a really nice illustration of different perspectives. And keep that in mind throughout. Now, I'm a researcher by training. I'm actually an analytical chemist, so I'm an evidence and data nerd, and I'm going to imagine that many of you on the webinar are as well. And so, you might be a little bit skeptical, like, why would I do patient engagement in clinical trials? So the good news is there's actually research being done on patient engagement in clinical trials. And kind of like clinical trials, it has both potential benefits and it has potential risks that you have to think about too. And I think that's part of what we want to walk you through in today's webinar is, of course, we want you to be excited about the benefits. At the same time, we also want to make sure that you're aware of the potential risks and think about ways that you can avoid those risks. So potential benefits, there are great examples out there of patients bringing to light core outcomes and domains. So things that are really important to them that maybe researchers hadn't thought about or didn't think were important until patients actually got to the table. In my community with respect to arthritis, fatigue and pain come up as huge things that are issues for people living with arthritis that our researchers and clinicians used to think would just go away if they got the disease under control. And that's not always the case for everyone. So there's a lot more research that's being done in those areas. If you have people on your trial team that live with these different conditions, they can tell you whether or not they'd participate in the study that you're designing and maybe help you to design some ways where you can lessen the burden on potential participants, which you could then imagine trickles down into increasing how many people actually participate in your study and keeping them retained in the study until the actual end of the study because things have been designed to meet their needs. They can also help in dissemination. The part that I really like, but that freaks a lot of researchers out, is that people can actually learn this together and they can grow together as a team. And imagine this, there's actually less research waste when you do research this way because you're designing questions that are more relevant to the people that are actually going to benefit from your research. So that's all the hype at the start, right? There is evidence to support these potential benefits. There are potential risks, and this is coming out in the literature and the research as well. So it can be frustrating for patient partners that research can be slow, right? And we often have different motivations, and we often don't have time that research takes. That 17-year gap that we always talk about and hear about, not cool if you're somebody like Jenna and like you want to live the rest of your life, right? And not wait 17 years for something to come out of it. So it can be really frustrating. Sometimes patient partner suggestions are just not feasible. Maybe it's money, maybe it's time, maybe it's a bunch of different stuff, but that can be frustrating as well. This does take more resources, and those resources might be people, they might be time, they might be money. To be quite honest, tokenism is a real possibility when you're engaging people who haven't been part of a research team, and maybe you're not really clear about how you do engage them or how you communicate with them. So we'll talk a little bit about that. I think something you have to be mindful of is that sometimes the people that you're bringing in as team members might actually relive painful or even traumatic experiences when they're talking about potential research or they're talking about their experiences. And they may not even be aware that talking about those things might trigger them. And so, that can be really difficult, not only for them, but for other members of the research team. And again, the part that I know as researchers can be fairly scary is we are trained to follow a protocol. You have to follow a certain recipe to get a gel to work. You have to follow a clinical trial protocol to make sure that the results are clean. And well, we're going to share with you today some of the really good guiding principles around doing patient engagement well. There's no protocol for you to follow at this point. There's no recipe for you to follow. And I think probably Yen and Jenna's stories will show you that things can be done in many different ways. And it doesn't mean that they're wrong at all. It just means that they look different based on the context, based on who's involved and those sorts of things. So you probably were taught at some point in your life this concept of the golden rule, right? And it's about treating other people how you wish to be treated. But I always tell people that when they're engaging patient, youth, and family partners, it's actually about treating them the way they want to be treated, which may or may not be how you would expect to be treated. And that might be because you have to think about maybe they need different supports than you would need to be part of the research team. Maybe you think they should be interested in all aspects of the research cycle, but maybe your patient or youth partners are really jazzed about certain parts and not so much other parts. So think about this a little bit like a negotiation. So you're going to have to learn what they want to be involved in, what works for them. And maybe sometimes they even have to step back because of their life or health. And they just might need to be involved in different ways than others on your research team, or how you would expect to involve others on your research team. So I just ask you to keep that in mind. And I'm not making this up. There actually is a platinum rule. There's actually literature about it out there. You can look it up if you'd like. Okay, so with that kind of foundation, hopefully, and it looks like many of you are already working with patients or youth partners, so hopefully you're ready to add to your toolbox. We also know that for the Impact Fellows, there will be a course on the RISE platform coming out in the next few months. And so we're going to give you a bit of a sneak peek to at least a graphic that you'll see there. We've tried to align things here with that, but we really hope that this is complementary to what you will learn through that course on the RISE platform. So ta-da, this is a graphic you're going to see as part of the Family Engagement and Research course that will be on the RISE platform. And what we're going to do is we're going to walk through each of these kinds of 4 stages, if you will. So planning the trial and what that looks like, doing the trial itself, analyzing the results of the trial, and sharing the findings. And again, for those of you who are Impact Research Fellows, I know that you're going to be working on protocols throughout the next year. And so think about what you learn here and how you can plug that into your protocols too. So before that RISE course is available, there are some good resources out there already. And I can tell you that they also complement what will come from Impact. So these are already out there. The Porch modules are more specific to child health. The CIHR Institute of Musculoskeletal Health and Arthritis modules are a little bit more based on probably adult engagement, maybe some youth engagement. They nicely complement each other. Some of the curriculum here are overlapping, and they each issue certifications of completion. The CIHR ones, even though they come from a specific institute, they are agnostic to disease area, and they are also available in English and French, if that's helpful. Both courses are super practical. They're free. So if you're a real keener, you can go dig around in those before the Impact course is available for you. So one thing we want to talk about, and this is where tokenism can play a role, is there's an inherent power imbalance in you inviting people from outside of the research world to be part of your research team. And that's because, let's just be honest, you hold the power. You are the person that's running the study. You have the funding for this study. You probably get to make all the decisions about the study. And so really be mindful about that. The other thing too is when people like Jan and Jenna come into a project, they often share like really personal information about themselves with the team. And that's information you rarely ask of your other research team members. So again, just be mindful about how you're creating a space where people can feel safe, where they can feel that there's less of that power imbalance. And so that's your goal, is to really even out the power imbalance. And just like we'll do throughout the talk, these are a couple of resources. Some of them are my own, so I'm sorry, but shameless sharing of some of those resources for you. One of the resources at the bottom here is like a really nice budget tool that helps you understand all the ways you might have to budget for engaging patient partners in your work. And that's not just potentially to compensate them for being a member of the team, but maybe they need or they've requested to take some courses. Maybe they're going to co-present with you at a conference. Maybe there are other kinds of accommodations that they need that other people on their research team might not need. Like maybe they need some help for childcare. Maybe they need different transportation needs, etc. So these are a couple of resources that hopefully can help you reflect before you go into your engagement and help you set it up so there's hopefully less of a power imbalance. Okay, so you're going to start to hear less from me and more from Jan and Jenna. So to come back to this kind of quadrant, we're going to walk through these 4 different kind of areas in terms of planning and conducting clinical trial all the way to sharing findings. So what we're going to do at each is we're going to hear from Jenna and Jan in terms of some of their examples of being involved in each of these areas. And then we'll kind of summarize things up and give you a few resources. And we've got lots of links here, which I believe are being shared in the chat, but you can always contact me or anyone on the team as well. We can share the links for you. So let's start off with planning the trial. And I'm going to turn things over to Jenna and Jan and see, maybe Jenna, you would like to go first in terms of sharing how you've been part of a team and what that's looked like when you've been planning the trial. And then Jan, I'll come over to you next and you can do the same, okay?
Amazing. So my name is Jenna Ketty and I'm 19 years old and I'm from Halifax, Nova Scotia. So I grew up going to the IWK Health Center, and it's almost been 2 years since I had my pediatric graduation and moved my way up to the adult system. So now I regularly see a bunch of different teams across different centers in Nova Scotia. I unfortunately don't have a family doctor, so I'm the result of that healthcare crisis. And I have been involved in patient engagement since I was 15 years old in a bunch of different ways. And I love giving back to this community because obviously I have an illness. So if I can help one person or one professional, the work is all worth it. But for specifically planning the trial, and I think this can go back on what I'm about to say, can go back on any research study when you're planning to involve people sharing their personal story. I think a big piece of your planning is to make sure that you have all your ducks in a row before you even bring your patients in. And that's something that I've noticed a lot, is that I've been called into something and I get there and not everything is organized, or there's a lot going on all at once, which that's totally fine. I'm all for the hustle, but sometimes they don't know how they're gonna like compensate their patients. They don't know what the time frame looks like, what the days of the week they're gonna need you are. Like sometimes I've joined them and the scheduling's a little off. So making sure that you have a firm schedule, you know what the compensation is going to look like, or you have a general idea, or if it is going to be a volunteer work position, making sure that the patients are aware of that right away. Because a lot of patients, including myself, are more than happy to also volunteer our time to these initiatives, but making sure that that's upfront so that patients know what they can and cannot do. And also just being upfront about who you're looking for. When you're getting ready to plan your advertisements and looking for your people, make sure you're crystal clear of who you're looking for. Because so many times have I seen someone just advertising they're looking for patients, but not being clear of what age they want the patients to be, who they want. And I've sent emails to people before and they're like, hey, you're not the right fit for this. And I'm like, it would be amazing if it said that on the poster, or someone that is the amazing fit could walk by that poster, read it, and not think that they're a good fit because they're like, that's not me. Making sure it's crystal clear of all the people you accept, and that if it's a specific niche, making sure that that's on your advertisements, making sure that's out there. So I think really planning should be a lot of like making sure that everything is perfect and ready before you even consider bringing patients into your project.
Thanks, Jenna. Lots of good tips. I hope people were like rapid fire writing those down. So it's not just planning the trial, but actually planning your engagement thoughtfully and really transparently before you bring anyone into it, right? Awesome. Jan, how about you? What would you like to share here?
Yeah, so it will be more slowly. Hi, everybody. I'm Jan. I'm from Quebec province, so usually I speak French. So I speak slowly and sometimes with strange syntax. I'm a father of two nice boys. The youngest one lives with a rare disease called SMA, spinal muscular atrophy. It's a neuromuscular disease, degenerative and fatal disease. 10 years ago, when we received the diagnosis, there's no care, no treatment at all. He's still alive because the community now have 3 treatments, and it's clearly the fruits of the partnership between the researcher and the patient. But when you talk about pediatric disease, it's not only the patient, the family is so important because it's not everybody who could express herself. But I would like to be more involved in the planning, because 10 years ago we missed the boat. The timing is when we received the diagnosis, the first clinical trial start for infant under 7 months, and unfortunately when the thing start, our son was 15 days too old. But 10 years later we have a lot of experience. And even if it's not perfect, the job is made, and now we could help the other one to improve the design, because we cross a lot of obstacle and bias and assumption from a lot of people. We try to find the better criteria to go fast on market and be funding, but because we live and we have the day-to-day realities, we know what industry could think, and the reality with the government, it's not always the same. So we have a lot of information to help a better design to really access to the gold on an ethic way. When you talk about fatal disease, risk versus benefit. Definitely you have to be partnering with the patient, because it's not possible for anybody to have the right vision. It's a necessity to collaborate. And yes, maybe I would start with this.
Okay, that's awesome, Jan. And I love the perspective that you're bringing for the group too, that like you're thinking a bit about the long game, that somebody who's so invested in this because of your son, like you're not just looking for potential treatments now, but you're looking to help design things so that ultimately a therapy gets approved, right? And actually gets used by people who need to use it. And I think that's important for people on the call to think about, is especially where you're coming from with industry-based drug studies. Like, you want the engagement upfront and early because ultimately you want this getting to people faster, and you want that just like we talked about earlier, you want the study to be designed so it's as relevant to people as possible. Okay, that was awesome. Thank you, both Jenna and Yan. And we're just going to add a few things to the points here. And some of these were talked about. So getting to know patient partners as people, right? I think that's really important for people to remember is Yan and Jenna aren't just like the disease that they come with, right? They're well-rounded individuals that bring lots of other skills and perspectives to the table as well. You know, it's important to be learning about the condition and their experiences. So some patient partners might be able to say, hey, I'd love for you to research this, right? Others might just be able to share what kinds of gaps they have in their everyday living, right? And that might lead to a research question. And it might lead to, well, how can we actually measure that to make things better for you? I think Jenna talked about a lot, like what are potential facilitators and barriers to even being engaged? Oh, sorry, you're not the right person, but you didn't advertise very well what the right person was right from the start, right? So there can be lots of facilitators and barriers to being involved. And then again, we talked about this a little bit earlier, but like how do patient partners actually want to be involved? And what are the options that you come up with them to be involved in planning the trial too? So there's a couple of resources here. One is by Richard Hovey, and it's a really nice paper on the fact that he's a person who lives with pain, but he's first and foremost a person, right? He's not defined by his pain. It may color how he looks at the world, but first and foremost, he's a person. And then we talked a little bit about tokenism, and I and some others have written a blog about tokenism. If you're not sure what tokenism is, you can think about it this way, and I'm going to guess most of us have had this experience where we've been invited to be at a party, an event, a workshop, and basically we don't talk to anyone there. We kind of sit in the corner. We feel really like we shouldn't even be there, right? As a patient partner, that can be just like a horrible experience. And it can even lead to people saying like, this isn't for me. Like, I don't want to be engaged. So the blog basically says like, here's what tokenism is. Here's some of the situations we've seen. And like, here's how you can avoid them as researchers. Or here's how, if you see them coming on, you can change directions. So a couple of other things maybe in the planning the trial part is, you know, collaborating to prioritize relevant research questions, understanding how you might measure the things you want to measure in a study, and assessing feasibility of the trial itself and what participation actually looks like, or maybe that changes based on conversations with family members or people living with these different conditions. So that's that first part of the quadrant, planning the trial. The next part is doing the trial. And again, I'm going to turn it over to Jenna and Yan to share some of their experiences first off, and then we'll kind of tie it back to some other things we've got on the slides. So how about if I start, Yan, with you this time, and then we'll go to Jenna next.
Yes, do the trial. Again, the partnering with the patient and the caregiver could help to improve. I could give an example. When they start the trial, we could with the partnering, we could improve the procedure when they make the administration of the drugs, because some parents are available to stay in the room, and they saw the impact. So yes, partnering help the improvement of the procedure of the trial, because the things could evaluate, and it's important to continue to collaborate all along the way and stay open to the improvement. It's a good example, and we saw a lot of family, it could be difficult to find patient. So connect with the leader of community could really help. We saw 10 years ago some parents create at the beginning. We read, protocol and reports. It's a really heavy duty reading, and the parent start to adapt in plain language to inform the other parents. But in our case, with rare disease, there's a lot of place in the trial. So it's often you see some family could move from other country, but to all the accommodation and all the obstacle, with the partnering, we could help to limit them and facilitate, bring some accommodation. Yes. And doing the trial, we could also be partnering even to raise money. Just another example, the SMA communities raise like $60 million in 15 years and bring 600 researchers to collaborate and work together to find and fill up the pipeline. So it's a good example again.
Thanks, Yan. There's lots of gems there, right? In terms of understanding what it's like to administer the intervention, or maybe making potential changes to that based on what it's like to live with the disease. And then you emphasize tons about why people should partner with the community, right? Maybe they fundraise, and in instances of many health charities and patient organizations, for sure, those communities are galvanized and fundraise for research and contribute research dollars. And then again, helping people understand how participants might need supports to be part of the study. And maybe they need accommodation, maybe they need travel support, all those kinds of things. So that's awesome. Thank you, Yan. Jenna, what do you have to add to that based on some of your experiences?
So from my experience, I had a lot of times where I was a patient partner, but not necessarily a participant in every single initiative that I've been a part of. So
Mhm.
there was times where I've helped with different initiatives related to my specific illnesses. And at that time, and it might not have been the time, or it might not have been something that I ever needed to explore of me actually utilizing the treatment or the service, but I was able to give my advice and expertise as being someone that lives with that condition in that community and actively involved in my chronic illness community. So making sure you know that definition well, and some of the folks like youth and patient partners who are not necessarily participants, making sure that you keep them in the loop on all the happenings that are going on, because a lot of the time we're the part where we put our heart and soul into the planning parts, into making sure everything goes, giving our expertise and doing what we can. But sometimes we kind of get lost in the shuffle, and we don't really know what happens. Like I've definitely been a part of numerous projects where I was a part of a couple of consults or attended meetings or wrote some articles or did some surveys, and then it's like 4 years later and I'm like, hey, I wonder what happened with what I put myself into. And then I go down the Google train to see where it went, because sometimes they don't update you on what happens. And like when that person like gives their time and energy, whether they're a participant or not, making sure that all the partners know where their information goes and what impact that they're making, whether it's a big impact or a small impact or no impact. We want to know what happened with the information that we give, as well as I think it's so important to make sure that you make sure that your partners in the whole process feel like they're really a part of the team. Because as I said, when we get lost in the shuffle, we obviously are not, I like to say, we're professional patients, but we're not the stereotypical medical professionals that are a part of those big conversations. But I think making sure that we are still in the loop in some way and can be involved, because we do give our valuable time and energy to these initiatives. So making sure we're always a part of it and feel welcome to be involved, because I don't want any patient partner to ever have the experience that was super negative for their first try into this world of patient partnership and then never wanting to give back their time again, because we could lose some really awesome folks that could give back some really good information to lots of different parts of healthcare. And we need those people at the forefront of our research and of everything we're doing. So I don't want to lose those people. So making sure that they have a positive experience and always following up with them and checking in and making sure that everything's good so we don't lose those people, and making sure that they're informed for years to come after things are ongoing.
Thanks, Jenna. Heavy communications emphasis from Jenna. I think not just for patient partners who are part of your team and keeping them in the loop and informed, but also for participants in your study, so that they are aware of what, I mean, that's just part of informed consent, right? But making sure that they know what's going on. And I think we'll probably come back to this a bit later, but in terms of sharing the results of the trial with them and helping them understand actually how they contributed to the research results. So awesome. Let's see what we've got here. Yan talked about sharing opportunities with their own networks. So patient communities have all kinds of communications between themselves. Maybe your patient partners would like to be involved in data collection or data monitoring. Are there courses and skills that would be helpful for them to be involved? We talked a lot about communicating clearly. Yan talked about plain language and helping develop materials in plain language, as well as keeping people informed. And those all lead to helping find people to participate and keeping them in your study. Okay, let's move on to analyzing results. Jenna, let's start with you if you've got experiences you'd like to share, and then we'll move on to Yan.
Absolutely. So I'm gonna also, for my talk today is very much on the communication piece. Communication can be everything. So when you're going in and analyzing the results piece of everything, I am not a math girl by any means. I am an art student through and through. Some of your patient partners may be math centric, but that is not I. So making sure that you explain to us what's going on, keeping us in the loop, communicating what's happened. Because as I said, we put our time into these initiatives because we care, because we want to know how it's going to happen. So letting us know the results, whether it went positive or negative, letting us know what happened with that study, because it's part of our professional growth as well. It's a part of our learning, especially for someone my age that's in university. It's a part of our, development and learning how things work. Maybe someday we'll be a part of research. So making sure that we're always informed on what's going on and what the results look like, and not sugarcoating things, because maybe the research did not go the way that you thought that it would, and that's okay too. And maybe we're wrong, because we are professional patients, but patients can't speak for every single patient in the world. So making sure that we're informed on the good and the bad, the ugly of the results, as well as just making sure that everybody that was ever a part of it is informed, unless they tell you that they don't want to receive emails anymore, then that's fine, that they're past. But making sure that everyone that wants to be informed gets the information and knows what happened and what is happening, because I think that is so important, because you want patients to keep coming back, and it's kind of nice for them to have a little something to take with them with learning and to share their experience with others on what happened. And I think it's really cool. Like, I've been a part of lots of things, and seeing it flourish and grow even years after I stopped being a part of it, and they're doing their own thing, hearing the results is always really interesting to know how things evolve and happen. I think it's really amazing to watch where some of this work can go.
Thanks, Jenna. And I'm just thinking, you've self-declared you're not a math girl, that you're an art student through and through. But I think that's actually really an important thing to bring up, is that because you're not a math girl, you might have such a different perspective when the results are being analyzed, right? And you might just think of things in such a different way than those of us who are giant math nerds, right? So I think that's just, I just really wanted to highlight that. That means, you're going to bring just a different insight that someone like me would not think of when we look at the results. So awesome. Yan, what about you?
Totally agree. To evaluate the right thing, you need the input of a patient and a caregiver to be sure to evaluate the right thing, because data, it's good, it's important, but they don't tell you everything. You have to see in the real life what this data could bring. I could give a great example. Sometimes result data could be negative, but the result and the impact is there. In neuromuscular disease, we hope to see some gain. So when you don't see on the data, you think, oh, it's failed. But in fact, you have to don't forget the patient usually passed the half of the year hospitalized, and now with the treatment is not there. So even if valuable people looking for some functionality, the quality of life and the important thing for the patient could be really away from what we are looking in the data. So yes, quality of life and data, it's not always simple to see behind, and you have much more chance to understand that when you work with and partnering with people.
Yep. I think that's great. That really nicely builds on what Jenna just said, that data, is one thing, but having people put some real life and lived experience context around that data, just it makes it so much richer and makes it much more applicable. Yeah.
To finish, again, data, point, how many point the level you up, it's just a point. But when you realize this small point make the difference between you cannot scratch your eyes from yourself and you could make it. It's nothing for a lot of people. But even if you don't see it on the line and the result, it's a big difference for people too. Could keep a hand to put sweat. So, and only patient and family could give you this kind of distinction.
That kind of insight. Yep. Great. Thanks a lot, Jan and Jenna. So Jan said that exactly, right? And looking at results and analyzing meaningful changes for patients and family. Maybe the data doesn't point to that, but like Jan said, someone being able to put their hand through a sleeve in a shirt is a really big deal for some people. Many of us may just take that for granted, right? But other people might, that's a huge deal. We talked a lot about, how results relate to lived experience and real world context. What should trial completion actually look like? And now we're going to move on to sharing results. And I shouldn't have these things up, but that's okay. So let's start with you, Jan, and then we'll go to Jenna to finish things off this time. Jan, you're on mute. That's okay. One of us had to do it eventually, right?
Yes. So sharing the finding and continue to be involved after different step of research, because if you want to access to the innovation, you have to continue to be involved and share testimonies from local authorities. And again, because the expert at the local authorities don't live with the disease, it's so important to make all the work live, to stay involved. And like I said, 10 years ago, we read inside the protocol and report the information, and even the family contribute. And now we have so nice video to explain the disease. It's a genetic disease, neuromuscular disease. It's complex, but with the right animation, we could easily make it understand even for young people. And when the research is done, if you want the communities follow and continue, you have to bring the right information again with the plain language. It's important. And the partnering with the community could help also, because inside the community you have immigrant people who don't have the native same language. So you kind of a social prescribing inside when you work in partnering with the communities. You could also access to this kind of resource.
So Jan's talking about the long game again, that for many families or communities, the end of a clinical trial is just part of the journey, right? Even if the thing is approved in Canada by Health Canada, it goes on this whole other journey to being reimbursed, to being priced, etc. Right? So lots of important points from Yan, that it's not just your trial, which is really important, but there's a lot that goes outside of that, and many more steps before it actually can really impact people in a large way. And lots of great points there, again, about plain language, about sharing information with communities, etc. Jenna, what would you like to add about some of your experiences here?
So I think sharing the results is for sure, like in the beginning, we all know from the ethics perspective, making sure that everyone knows where the results could go and stuff like that, and making sure you have like aliases for people if they want that, making sure that everything is ethically proper, super important when sharing. But I think in some cases you should share the results more than you do, because I think more people might want to learn about it, because like so many of us day to day, we love Dr. Google. So if something could come up that was actually like legitimate and nice would be really great. So getting into that algorithm would be super helpful. So not being afraid to explore other social medias like Instagram and stuff like that. I find I see a lot of content on there that is like, oh, look at this medication, or look at this. Maybe I should mention that to my provider to see if that's an option for me. And I think that's the cool part of social media. We're able to share this work with so many people and help even more lives. But I also think with sharing results, a big thing Anne said is something that's near and dear to my heart as someone I worked with quite a lot of refugees last year in my job, making sure that it's accessible when it comes to language and making sure that there's no barriers there. But even when you write it in English, I think a lot of Canada is English and French. So usually it's English and French, making sure you have other languages or making it easy to translate and testing the translators to see if it like works well. But even when it's English and French, making sure that the language is language that everyday people know how to read and it's not just medical lingo, making sure that it's accessible and easy to read for people, and also making sure when you're sharing it, like if you're sharing it on social media or if you're sharing it on a website, making sure that those channels are all accessible as well. So making sure that your captions are accessible to like the visually impaired community, making sure you have it made so that it can be voice to text so that everybody can have the option to access the resources. Because I think that's so important, because I think the magic of some of these studies is super awesome and I want the whole world to see it, but I want to make sure that every single person has an opportunity to fully access, read, and enjoy what the results have to offer. So potentially that could change their life or change someone they know's life. So I think making sure that's accessible is super important.
Thanks, Jenna. That's an awesome note to end on about the accessibility of the results that you do share, whether that's language, whether it's an infographic, whatever that looks like. And I think most of that is kind of emphasized here. And if you do work with patient partners, you should consider co-presenting just like we are today, right? I think Jenna made an important point too, that if you're going to have patient partners as co-authors, or even if you're going to acknowledge them, how do they actually wish to be acknowledged? For some patient partners, authorship really isn't important, even if they meet that criteria. For some, it really is. But then they'll be identified as a patient partner. And again, maybe that's okay for some people. And maybe other people are a little bit more careful about how they choose to declare that. So it sounds like such a simple thing, but you'd be amazed how complex it can be. And it's just really important to be thoughtful about that. And then lastly, there are resources that some of us have worked on around like, how do you co-author things with patient and youth partners? And how can you actually use different templates to actually share your results back with participants as well? So that brings us right back to where we started with Jenna and Yan in terms of engaging patients as partners throughout a trial. I'm just going to ask before we wrap this up, and I think we've got a time for a few questions before our hour is done. But Yan or Jenna, is there just one like lightning round thing that you would like to share with people? Like if they didn't hear anything else from our conversation today, what do you want them to walk away with? Jenna, would you like to go first?
Or a big piece for me would be don't be afraid to involve us in your work, because I know it probably it's intimidating for us, but it probably is intimidating for you as well to ask someone with patient experience, which I'd say majority of patient experience, it's obviously someone who's undergone something medical, whether it's mental health, physical health, they've undergone something that was not so great in their life to make them be in the hospital or in a healthcare setting. Because most of the time when we end up in a healthcare setting, it's not a pretty situation. So you're asking people to share some of maybe the darkest moments of their life or some of the most difficult moments of their life, but don't be afraid to reach out to us and ask for our help, because I feel like for myself and a lot of other people I know that do this work, it is so special to be a part of it because it gives us so much purpose in the struggle and the trauma that we deal with day to day. Being able to help other patients and the healthcare system as a whole is so rewarding for us, and we love to give back our time. So definitely don't be afraid to reach out to us. Don't be intimidated. Some of us may say no, which is totally okay and valid, but some of us are really excited to be involved. I recently actually posted on Facebook about one of my initiatives that I'm a part of, and a girl that I go to university with was like, "How do you become a patient partner? I've never heard of this." And she also has multiple chronic illnesses, so I was able to give her some insight on that. So making the information that you're looking for people public, don't be afraid to reach out to us, because a lot of us would be so excited and love to give back to whatever you're working on.
Awesome. Thanks, Jenna. How about you, Yan?
Sooner is better. I think there's no recipe, like you said, but there's always a way to involve people faster.
Yep.
Planification, it's so important, but perfection, it's a hard thing and not necessary. So don't be afraid, and the things could always together in the collaboration. The things will. If you are honest and openness and have empathy for the people with who you work, it will be okay.
Awesome. That's great advice. Thank you, Yan and Jenna. So this is just one last resource that I wanted to share that Lauren Kelly and some of her patient partners and research collaborators have written about some of their experiences of co-designing clinical trials with youth partners. So just wanted to share that so that you have it, because they share all kinds of great insights that Jenna and Yan had also shared here today. And I think, Maureen, we're going to pass it over to you if we've got like a couple of minutes for questions. I don't know if we do. I'll leave that to you.
I think what's going to happen is that we're going to keep the question period for the fellows who are staying on for the last half hour. So apologies to everyone else who's here. But if you have questions, you can contact us, and you'll see that Jenna and Yan have put their email addresses on the last slide. They're willing to also be contacted, or you can contact anyone in Impact. We would be happy, and I know Dawn equally is very generous with her time. We would be happy to answer any of your questions. We brought on these two wonderful speakers, our mentors. They had so much to share that we filled up the hour very quickly, but I think we can all agree that so much gratitude for what they have shared about their lived experience, and to Dawn, who's brought this incredible team together to pull together the first Impact webinar. And we were up to 83 at one point, so we're very, very proud of all the people who have joined in. It's as a patient partner, it's just very gratifying for me to see so many people interested, and hopefully you've learned something. And hand it back over to you, Dawn.
Okay, thanks, Maureen. So obviously, Yan and Jenna have okayed for their emails to be shared here. And I think just the last thing that we'll do is just revisit the learning objectives. Hopefully you feel like we've come away arming you with these things. And then we'd just like to do kind of a closeout poll to see how people have felt that the webinar has gone for them. And then, as Maureen said, I think we've got about a half an hour or so where it's kind of like an ask me anything with the Impact Research Fellows. So Chelsea, could you just launch the poll again? So this is kind of like, will you engage patients as partners in your work? We know that a few of you are already doing that, but maybe for those of you who are skeptical or scared, you know, the words of reassurance from Yan and Jenna have made you feel like you're feeling a bit more okay about it. So we'll just give you a few more seconds and then we'll just share the results here. So if you really want to get your answer in, click it in and then we'll share it in a moment here. I think we're probably good to share, Chelsea. Yeah. So it looks like we've won a few folks over. Congratulations, Jan and Jenna. You've sold a few more folks on why they should be up to this. We have a few people that are still a little bit worried, but hey, hopefully they'll reach out to us, or with some of the resources that we've provided, they'll feel comfortable in moving forward with it. So I think that's it for me, Maureen. Any other words you'd like to wrap things up with?
No, just to ask our Impact Fellows and Enrichment Group to stay on the Zoom link for the remaining 30 minutes. And just a huge thank you again to everyone involved with the webinar, and especially all of you wonderful people who participated. And carry on with your patient engagement.
Okay, so we'll wrap up